20 alarming signs your kidneys might be failing. Did you know that your kidneys could be struggling quietly without you even knowing it? Think of your body like a well-oiled machine, with your kidneys serving as its filter. But what if this filter gets clogged without you even realizing it? That's what happens with kidney disease. The tricky part is, most symptoms don't show up until the disease has progressed significantly. But don't worry, we're here to shed light on these hidden signs. Number 20. Metallic taste. Ever noticed your food tasting a bit off? Like you've just licked a piece of metal? It could actually be your body's way of signaling trouble in your kidneys. When waste builds up in your blood, it can mess with your taste buds, leaving a metallic tang in your mouth. Not only that, but you might find yourself avoiding certain foods or even shedding a few pounds unintentionally. Number 19. Fatigue and weakness. If you feel like you could use 100 naps throughout the day, it might not just be a case of the Monday blues. Your kidneys are incredibly important when it comes to keeping your body in tip-top shape. But when they're not at their best, toxins start building up, leaving you feeling like you've been hit by a truck. Plus, there's this hormone called erythropoietin that takes care of your energy levels by producing red blood cells. But when your kidneys aren't on their A game, this hormone takes a nosedive, leaving you feeling as weak as a kitten. Number 18. Feeling faint, dizzy, or weak. Speaking of feeling weak, have you ever had those moments where the room suddenly starts spinning? Feeling like you might just faint out of the blue? This might also be a hidden sign of an underlying kidney problem. Tying it back to erythropoietin, when the erythropoietin levels are low, the body has fewer red blood cells to go around. This can mess with your blood's oxygen levels, leaving your brain feeling a little starved. That's what leads to syncope and dizziness. Number 17. Foamy urine. Now let's talk about the kidney's most known function, urine production. Ever looked at your urine and noticed it looking a bit frothy, like you've just poured a soda? This could be your kidneys trying to wave a red flag. When your kidneys aren't working well, they end up excreting stuff like proteins from your blood. When these proteins end up in your urine, they can turn it into a bubbly, foamy mess. This is called proteinuria. Number 16. Blood in your urine. Another important sign your kidneys might be in danger if you notice blood in your urine. When your kidneys are damaged, instead of keeping the blood cells where they belong, they start sneaking into your urine. This is especially important if the blood in urine is painless, indicating an underlying tumor or some other sinister culprit. Number 15. Frequent urination. Keeping with the problems in urination, when your kidneys aren't working properly, they might struggle to keep your body's fluid balance in check. This means you might find yourself needing to pee more often. Feeling the urge to pee more, especially at night, could be a sign of kidney disease. Damaged kidney filters can make you feel like you need to go more often. Sometimes, though, it might also be a sign of a urinary infection or a swollen prostate in men. Number 14. Feeling cold. Moving on, let's talk about another symptom that might have slipped under your radar. Ever found yourself shivering when the temperature isn't too cold? This could be because of the anemia caused by kidney disease, leaving you unable to regulate your body temperature. With the kidney's myriad of functions, even small nonspecific clues like these can point to an underlying pathology. Number 13. High blood pressure. Did you know that kidney failure is one of the most common causes of increased blood pressure? Think of your kidneys as the body's own control center for blood pressure. They release hormones that help keep the balance of fluids and electrolytes in check, which directly affects blood pressure. But when your kidneys aren't working right, it's like this control center goes on strike. The hormones that usually keep your blood pressure stable can't do their job, so your blood pressure starts acting up. This spike in blood pressure can really strain your kidneys and make any existing kidney issues worse. It's like a vicious cycle. High blood pressure makes the kidneys work harder, but then the kidneys malfunction, causing even higher blood pressure. Chronic kidney disease can also make your arteries stiff and less flexible. Stiff arteries make it harder for blood to flow smoothly, which cranks up your blood pressure even more. Number 12. Shortness of breath. This is something many might usually associate with a respiratory problem, but even a problem in your kidneys might leave you out of breath very easily. When your kidneys hit a rough patch, toxins start piling up in your bloodstream. These toxins, like urea, can metabolize into ammonia, wreaking havoc on your system. Couple this with the anemia that your kidney disease causes, and it's a perfect storm for feeling out of breath, tired, and weak. Number 11, persistent bad breath. Another symptom you wouldn't normally associate with kidney disease is bad breath. Kidney failure can turn your breath into an ammonia-scented air freshener. And if that's not enough, high levels of urea in your bloodstream can add an extra layer of stench to the mix. So if your bad breath refuses to budge, it might be time to pay your doctor a visit. Number 10, lack of concentration. Ever felt like your brain's stuck in a fog, making it impossible to focus? This might be because of an underlying kidney disease. When your kidneys aren't pulling their weight, waste products start piling up in your bloodstream, turning your body into a trash heap. When these toxins sneak past the brain's defenses, it can affect your brain function, leading to a decreased ability to concentrate. Number 9, difficulty sleeping. On a similar note, have you ever tossed and turned all night, unable to catch a wink? If yes, even that might indicate a problem with your renal system. Kidneys do more than just filter blood. They also help regulate hormones. But when they fail, it can throw these hormones off balance. For instance, hormones like erythropoietin and renin, which are important for sleep, might get messed up, leading to insomnia. Plus, some folks with kidney failure might also deal with sleep apnea. This condition interrupts breathing during sleep, making it hard to get the rest you need. All these factors combined can really make it tough to get a good night's sleep when your kidneys aren't working right. Number 8, itchy skin. Did you know that kidney failure can cause your skin to be extremely itchy, a condition called uremic pruritus? When your kidneys fail, waste products, specifically nitrate waste product like urea, start piling up in your bloodstream as the kidneys cannot filter them out like they should. This buildup of waste can collect at your skin, resulting in extreme itch. Number 7, muscle cramps. Your kidneys help keep the balance of electrolytes in your body in check. But when they're not doing their job properly, these electrolyte levels can get out of whack, causing muscle cramps. Take potassium, for example. It's a mineral that's crucial for muscle function. Normally, your kidneys filter out any extra potassium and get rid of it. But if your kidneys aren't working right, potassium levels can go up, leading to muscle cramps, weakness, and even irregular heartbeats. On top of that, muscle cramps can also be caused by dehydration and uremia, both conditions usually caused by kidney diseases. Number 6, persistent puffiness around your eyes. Ever woken up to find your eyes looking puffier than a marshmallow? It might not just be a case of too little sleep. Just like we've discussed, when your kidneys are not working properly, they can't keep protein where it belongs inside your body. Instead, might leak into places they're not supposed to, like around your eyes, leaving your eyes looking like they've been hit with a punch of puffiness. Number 5, swelling in the legs, ankles, and feet. On a similar note, you can also feel swelling in your feet, legs, and ankles as well. Just like we've discussed with the puffiness around the eyes, when your kidneys malfunction, fluids and waste products start backing up like a traffic jam. And when these fluids decide to set up camp in your legs, ankles, and feet, it's like trying to squeeze into shoes 2 sizes too small. But remember, while swelling in your lower extremities could point to kidney trouble, it's not a one-size-fits-all diagnosis. This can also happen in liver diseases like hepatitis and chronic liver failure. Number 4, pain in the kidney area. Another sign your kidneys might be in trouble is if you're feeling pain in your upper back, just below your rib cage on either side of your spine. This pain might come and go, or it might stick around. And it might not come alone. You could also have symptoms like fever, chills, nausea, or vomiting. Number 3, nausea and vomiting. Kidney failure can lead to a buildup of waste products like urea, creatinine, and toxins that can cause nausea and vomiting. It is like when you eat something that's gone bad, your stomach can't handle it, and it makes a hasty exit. The same goes for the toxins in the stomach, and they make a hasty exit through the mouth. Plus, problems with your kidneys can mess with the balance of electrolytes in your body, which can really upset your stomach and make you vomit. Number 2, poor appetite. Ever found yourself pushing your plate away, even though you're usually a foodie? It might not just be a case of picky eating. Your kidneys could be trying to send you a message. When your kidneys aren't pulling their weight, toxins start building up like unwelcome guests at a party. These toxins can affect your appetite, leading you to feel less hungry than usual. Number 1, changes in your hands. Did you know one of the telltale signs of excessive urea in your blood can be found just by looking at your hands? Physicians check for a sign called asterixis, in which the hands start flapping uncontrollably, indicating that urea has reached the brain, a condition called uremic encephalitis. Not only that, in advanced kidney disease, you might notice a white color on the top part of one or more nails, with a normal to reddish-brown color just below the white part. Sometimes, there might even be white bands running across one or more nails. If you ever notice any of these signs, don't panic. But also, don't ignore it. Better be safe than sorry. The best course of action would be to contact your healthcare provider and get checked out immediately.